Hello, and thank you for tuning into McDougall's Medicine with Dr. John and Mary McDougall. I'm their daughter and your host, Heather McDougall. And tonight we're going to start out with research and the latest news and then get into general questions. So I apologize for being a little bit late. We're having some technical difficulties, but we're back now. Hi, Mom and Dad, Dr. McDougall and Mary. Great to see you. Let's get started.
Well, unfortunately, they will never hear my rant and rave that caused the computer to shut down, but I'll try again. Anyway, somebody will worry because the books I've written, the newest one was in 2011. And you say, well, all he does is quote old research like it's at least 12 years old. Well, what I'm here to tell you is they got it right the first time. And what I spend a lot of my time doing is I love the science. I love to read research. Mary reads novels. I read, well, I can't tell you how many journals I read, but that's entertainment for me. And what I find is the truth is the truth. It doesn't change. And so, I go around finding different things. They give you the current scientific evidence that what I've been telling you for 47 years is true and is not exaggerated. And plus, we give you the research articles in the chat, so you can look it up. You can find out if I'm exaggerating or if it really is true. Okay, let's start. This is November 11th, 2023. Couldn't be any more fresh.
No.
New England Journal of Medicine. That's the wrong study.
This is the one
Where's the one
right
out?
here. Right here. This blue one.
Okay.
That's what it started with.
Sort of. Okay. This is called ischemic left ventricular dysfunction. Adding PCI to medical therapy did not reduce a composite of death or abort sudden death. And this was published in Circulation 2023. Okay, so that's current enough.
November 2023. So
See the November?
yeah, right here.
All right, November. You couldn't be more current, could you?
More current.
Anyway, what they did is they did a study, randomized controlled trial. So it's really good, right? A study of people who had damaged left ventricles. Now, when a treatment is of weak benefit, if you apply it to really sick people, because they're really sick, you can see the benefit, even though it's a weak therapy. But if you apply
But do they get much benefit or do they just get a little benefit?
enough that's statistically significant, and that's what doctors and scientists care
okay.
about. But
But that, how much is that?
just tiny bit.
Just a tiny bit.
Just
Okay.
tiny bit. You're supposed to. But Mary, in these people had severe left ventricular dysfunction.
Right.
Normally, your left ventricle is supposed to squeeze out 65% of the blood. When you've got a damaged left ventricle, it's less than 65%. It may be 10%, 20%, 30%. These are really, really sick people.
How can they even walk?
Some of them can't.
Okay.
Some of them can't. Anyway, that's the intervention they give. I know I have that study around here someplace.
Well, that's up there.
Oh, here it is.
That's out.
Oh, there you go. Okay. Anyway, the conclusion is, among patients with stable angina who were receiving little or no anti-anginal medication, they had no objective evidence of ischemia. Well, this is the one. This what I'm looking for is this one.
You didn't get that far down there.
All right. Well, what they showed is that there was no survival benefit, okay, from PCI intervention. Anyway, you can look it up. Okay. All right. Sorry, folks, but I dropped all my papers. The reason since it doesn't result in any benefit as far as survival is concerned. The reason the doctors say, cardiologists, et cetera, say that they do the surgery is for incapacitating chest pain unrelieved by good medical therapy. Well, incapacitating would be things like you can't walk out to your car, you can't go grocery shopping, you can't do your favorite sport. If you got chest pain, climb up a mountain. That's not incapacitating because you don't ever care to go that again. But if you have incapacitating chest pain, what this study shows And this one was New England Journal of Medicine, November 18th, 2023. It shows that they did relieve angina by doing PCI, angioplasty, but that's all it does. It's symptomatic relief. And what you'll learn by going through the science that I provided for you, if you change your diet, you get relief of chest pain. And that's been shown since the 1960s, just by going on the McDougall diet, low-fat diet. Anyway, another failure.
That's what you did.
Oh, here it is. Let me just read the
Oh,
title.
okay.
I know where I got confused. In ischemic left ventricular function, adding PCI to medical therapy, that means angioplasty, did not reduce a composite of death or aborted sudden death. I can show you at least 15 studies, randomized controlled trials like this, that all show the same thing. None show otherwise. There is not a single study published that I'm aware of that shows any survival benefit going through this procedure that costs $30,000. And not only that, it subjects you to risks. Anyway, okay.
And the recovery period afterward has got to be
Well, that's
awful.
open heart stuff. This isn't so bad. They just go through the
This
harder than
is
like-
okay.
angioplasty, or in the arm. They sometimes do it in the wrist. Okay, so I've told you in the past, adult type diabetes is, well, just like the word says, adult type diabetes. And then they used to have childhood diabetes. They used to call it childhood diabetes. Now we call it type 1 and type 2. The reason is back when I first started studying medicine, the kind of diabetes that's caused by damage to the pancreas, type 1, occurred mostly in children. But now the children are so fat and sick, they're getting type 2 diabetes, and that's the more common kind of diabetes. So you get fixed on the idea that type 1 is childhood and type 2 is adult. But the truth of the matter is that the median is 24 years of age.
I mean, that's when they usually get it now?
Yeah, half the people get it over the age of 24.
Wow.
So you have people who are out there thinking, well, I must have type 2 about it because I'm an adult. But somehow I can't get this under control. I can't get rid of my diabetes when I lose the weight, etc. You have what we call type 1 or type 1.5 diabetes. And that's all discussed in great detail. All right. I have been recommending aspirin.
That's right there.
Now, I've been recommending aspirin as part of my recommendations before 2001. I changed my recommendations. You can look it up on my website in the year 2011, when I wrote an article on use of aspirin. At that time, the medical profession had come to the realization that because aspirin has such a weak benefit, you had to apply that therapy to really sick people who had heart attacks, strokes, heart surgery, etc., or you couldn't see the benefits because it's such a weak therapy, just like statins are such a weak therapy. So the standard recommendation is not to recommend aspirin for people who are relatively healthy, which is probably 90% of the population. And probably a good share of those people, most of them have taken aspirin at least one time in their past.
Didn't that used to be a common thing? You take a baby aspirin if you had a heart attack or something like that?
Well, even people who are healthy, Mary.
Oh, they did?
Yeah, it's just general recommendation. It used to be everybody should be on baby aspirin. Everybody should be on statins. They put statins in the
I
drinking water.
remember that, yeah.
All right. So anyways, I used to recommend a baby aspirin a day, but I have to stop, folks. It's not that I've ever changed my opinion. Remember, I've told you many times that I reserve the right to change my opinion about therapies because the data is incomplete. But you won't see me change my mind about the data because I've studied that thoroughly and about diet. I won't change my mind about diet because I've really put a lot of work into finding it right the first time. So here's a change in drug recommendations. I don't think I could even offer it to people who are really sick, aspirin, daily aspirin, low dose aspirin, which is baby aspirin, and the risk of stroke and intracranial hemorrhage in healthy adult people, healthy adults. And this was published in JAMA, the reference you have there. And what they found is the study found a significant increase in intracranial bleeding with daily low-dose aspirin, but no significant reduction in ischemic stroke. Yeah. Don't take it. Now, I have to add one caution here, and that is if you read my 2011 newsletter, which you find under Hot Topics, under heart disease, okay? You find it under Hot Topics, Medicine, Heart Disease. If you read that, I offer some caution about stopping aspirin suddenly. Nobody else seems to do this, but there's a study that showed an increase in risk of stroke in people who suddenly stopped aspirin. So in there, it tells you how I recommend you get off aspirin. But the truth is, pretty much 100% of my colleagues just tell you to stop, and they don't worry about increased risk of stroke. And I have to say, probably I would have that recommendation too, because the data is not great. It's this one particular study. So, all right. Oh, I want to talk to you a little bit about the GLP-1 agonists, like Wegovy and
Monjaro.
There's a
Ozempic.
Webpound too. Webpound.
Yeah, I haven't read much about that one yet. That's the new one.
Ozempic, yeah. Anyway, they're telling you now that these things reduce the risk of heart disease, Alzheimer's, of course, diabetes, all kinds of conditions. It's just like they used to say that about hormone replacement therapy. Oh, it works for everything. But they soon found it increases risk of breast cancer, uterine cancer, gallbladder disease, and all kinds of problems. So they stopped saying that. Statins, the same thing. They used to make a claim that statins would treat Alzheimer's, treat all kinds of problems. Well, here they are making a claim that these GLP-1 agonists are going to convey all kinds of health benefits we never knew about. The health benefits come from weight loss. Okay. If you lose weight, 5% of your body weight, and they lose 10, 15, sometimes 20%, you get a dramatic reduction in risk of dying from heart disease. You get a dramatic reduction in diabetes. It's the weight loss. There's no special secret mechanism involved here. These drugs make you so sick, you lose weight. Do remember.
You know, there were, just as an aside here, there were articles in the newspapers that I was reading this morning instead of a novel about how people are dreading Thanksgiving dinner because they take Ozempic.
Yeah.
And they're upset because they figure their relatives are going to pick on them because they're not eating any food.
Yeah.
And they're going to ask them, they're going to have fights about why they're taking Ozempic and all this stuff. And they're dreading Thanksgiving dinner.
Yeah.
And they're even asking, could I stop taking Ozempic a week before?
Yeah.
So that I could eat my Thanksgiving dinner and enjoy it and then go back to taking it afterward. So you must just feel terrible when you take it.
What do you do? You can't eat. You go to Thanksgiving dinner. Nothing looks good. You lose that. You lose your hunger. You're sick. And people wonder what's wrong with you. Why aren't you eating, George? You know, what's wrong with you? Don't you like the food? Read that same article too.
What did you? Okay.
So anyway, add that to the complaints of the food industry, who are all upset because people in America, good share of them are on GLP-1 agonists like Ozempic. They're not buying products. They're not buying the junk that they usually eat. They're not buying as much of anything that comes in the area of food. Anyway, I
wonder what they're going to do to fix that. Be interesting to see what comes out next.
This would be an opportunity for us to stop for a minute, Mary, and tell people how we approach Thanksgiving. Would you ever not eat? I mean, of course, you're not on Ozempic. Your appetite's great. But what do we do? What would you do if you went to somebody's house for Thanksgiving?
Well, I would just eat you mean if it was a regular?
Well, say you were fixing the dinner, you knew everything was good.
Oh, well, I'd eat everything.
Yeah, no.
I mean, I eat stuffing out of my stuffed pumpkin. I'd eat the mashed potatoes and the gravy and the mashed sweet potatoes and everything.
The broccoli,
Cranberries.
Yeah.
Beans, green beans.
The dressing and the gravy you make is unbelievable. Put that over anything. So she would go to such a meal, she would just select. You know,
and I'd have a huge plate full.
Yeah.
I'll take a picture of my plate.
Okay. Cochrane collaboration. I've been telling you that this is about diuretics. first-line diuretics versus other classes of antihypertensive drugs for hypertension. What I've told you many times in the past is that other drugs like ACE inhibitors, angiotensin receptor blockers, beta blockers, calcium channel blockers, all that stuff the doctors are putting you on, they lower blood pressure, but they don't reduce the risk of heart attack or stroke. What they say here is thiazide.
What's the point?
Oh, what's the point?
Just to make people feel better.
Well,
better?
I didn't mention one class of antihypertensive drugs.
Oh, okay.
Thanks, Mary, for bringing me. There's only one class of drugs that is of benefit, and these are your diuretics. And there's really only one diuretic that works well. Hydrochlorothiazide doesn't. Chlorothalidone does. And
Oh, the only one you use.
it's the only one I use. Okay, let's see. Thiazides and thiolite drugs are likely to decrease some mortality outcomes, such as cardiovascular events, compared to beta blockers, calcium channel blockers, race inhibitors. That's a Cochrane collaboration. That means there's somebody who looked at a lot of data and came to the conclusion that, if you want to just have a low blood pressure, we got lots of drugs that do that. If you want to reduce your risk of heart failure, strokes, then you take the class of drugs called diuretics. And if you want to take the right diuretic, then the ones that have been tested the Veterans Administration studies back in the 70s and early 80s, then you pick chlorothalidone. And that's the drug that we usually put people on who need antihypertensive therapy who come to our clinic. And how often do we prescribe it? Not often, maybe once a program. But we just took the person off of 5 other medications for blood pressure. Anyway, I think that's important to know. Let's see. Oh, I just wrote another article, a letter to the editor. I didn't tell you about this.
Okay.
I just wrote an article to the New England Journal of Medicine about another one of the monoclonal antibodies used to treat Alzheimer's disease. Okay, this is, we conducted the 2 phase 3 trials called the Graduate 1 and 2 trial. And what they found is no decline. It got rid of the plaque, but was not associated with a slower clinical decline. It says right there, it doesn't work. And Leqembi and another drug that came out before that, they were so horrible in their results. 20% of people have brain injury from these drugs, like bleeding in the brain. And they had a reduction. This one showed no improvement in clinical benefit over the course, which was probably a couple of years. The other ones, it's like a 27%, 37% reduction. In this letter to the editor, I pointed out that, the name of the drug I would use for Alzheimer's.
Oh, deferoxamine.
Deferoxamine. You could never call it DES.
Yeah.
It was originally called DES. It's called deferoxamine. And what it does is an aluminum chelator, trivalent aluminum chelator. It grabs aluminum from your body and your brain and removes it. In a 2-year study, those that were given the deferoxamine ended up clinically twice as well as those who didn't get the drug.
People would have to really ask their doctor to give them that, though, right?
They would have to beg their doctor to find a real deferoxamine. You can find it on Amazon. So it's not like
Yeah,
you
but
can't.
you have to have a prescription for
You
it.
do. All right. Review article in the Journal of American Medical Association. I've got this out of order, unfortunately. But there are all kinds of complications that they talk about that we really didn't. Serious stomach problems. Anyway,
Oh, well,
pancreatitis,
they
nine
did
times
is
is greater.
I figure they put this drug on the market way too soon, like the Ozempics and all the other ones, because it made people lose weight. And they really didn't test it very well for all the other stuff that it's doing to people.
But that's your position, Mary. My
Yeah.
position is they didn't give a darn.
Oh, okay.
They don't
guess
care.
I was
They
being
don't
nice.
care. They just want to get the drug on the market. It has to be proven statistically significant and not kill you immediately. But it could kill you over the long run. Let's see. Anyway, 4 times the risk of 9 times the risk of pancreatitis, 4 times greater risk of bowel obstruction, 3 times the greater risk of gastroparesis. That's,
I bet they don't tell people that either.
Gastroparesis. The problem is the stomach won't empty. And so you get rotting food in your stomach when you take these drugs. And your breath stinks like it. Anyway, they go
You
on.
must feel terrible too. Have a full stomach all the time.
Increased pulmonary complications, pulmonary aspiration. Yeah, all right. Well, you can read about it. I gave you the article.
That's
The new drug. See, this is the new drug.
Oh.
Zepbound.
Zepbound.
And that's the
Okay.
same as
Oh, it's made by Eli Lilly.
yeah, it's the same drug as the other one. It's not Wegovy, it's not
New Ozempic, Mounjaro.
That's Mounjaro. It's Mounjaro is given for diabetes. Zepbound is given for weight loss.
Zepbound.
Zepbound. Zepbound.
Oh,
All right.
just okay. Just for all right.
Okay, I think
Yeah.
oh, here's my article.
All right.
See,
You talked about that.
I know. And then there were some comments that I found out of the newspaper that I found interesting for you. The food industry warned on paid influencers. Companies are hiring dietitians and other, quote, respected people, like the American Beverage Association, Coca-Cola, Pepsi-Cola, Canadian Sugar Institute. They hire these people to go on and make advertisements, podcasts.
They don't even have to be respected people anymore. They hire TikTok influencers. Somebody who has a whole bunch of followers on TikTok, and they just tell them to say great things about their product.
Uh-huh. Well, Mary, I had a couple more here. I'll have to save them for next
All
time.
right, we'll find them next time.
All right. What happens when you drop your papers on the phone? All right, Heather. That's all I have to say. But it was a typical week of me going through the science and finding stuff that, and again, you may think I'm cherry picking, but this is what the research says. And again, the truth's the truth. If they established it 100 years ago, it's still true.
You'll have the same amount of papers next week.
No,
I'm sure you will.
I'll try. Anyway, Heather, do you have any questions?
So many. Okay, where do I start? I put all those articles in the comments about tonight's video and the notes about tonight's video, so you can do some more research if you'd like there. Okay, first question from Kate. She wrote in wanting to know the appropriate daily fat intake for maintaining regular menstrual cycles in healthy women during their reproductive years.
The amount of fat they need to eat.
Fat they need to eat.
Yeah, well, I get emails every so often from women that have lost a lot of weight, and so their menstrual cycles have stopped. So
I think they
we
stopped the period.
yeah.
Well, this is something that was most dramatically observed in concentration camps during World War II. The females that were starved all lost their periods. They stopped ovulating. And why did they stop ovulating? Because by nature, the message was there's no food, so you need to make no more people. So they stopped ovulating. So with too few a calorie intake, it's calories, it's not fat. It's calories. Too few a calorie intake will result in stopping your period. And that's also compared to exercise. The other group of people that lose their menses, their menstrual periods, are runners. Triathlon, marathon, female runners, because their output exceeds their intake.
Heavy duty runners.
A marathon, triathlon, yeah. So they lose their periods too. So you just need to eat a lot of food. How much fat? Well, your fat requirement is less than 1% of the calories. And preferably vegetable fat, because only vegetables make essential fats. No animal, no cow, no pig, no people make essential fats. Only plants make omega-3 and omega-6 fats. So how much do you need to keep out of essential fatty acid deficiency? Fewer than 1% of the calories. How much is in the food? Well, let's see. let's see, corn is, I think 10%, no, 8%. Potatoes are 10%. Oatmeal is 16% fat. Nuts and seeds, of course, are much higher in fat. They could go up to 80 to 90% fat. So it is impossible, as long as you're taking enough calories, to get into a situation where you lose your period. And by the way, we still have time for you to watch it on the West Coast, probably on the East Coast too. On CNN tonight is a documentary on periods, menstrual periods. It looks like it'd be well worth watching. It's on at 10 o'clock Eastern time on CNN as a special documentary. We're going to watch it, because this is an area of mystery. You need to know, though, when you're watching this, that your diet has a tremendous influence on your menses. When you eat a high-fat diet, high in animal products, you end up causing hormone imbalances, excess of estrogens. So as a result, you get a endometrium, which is the lining of the uterus, to grow too thick every month when you're on the Western diet. So you have heavy periods, you have blood clots, pain, from the Western diet, from the overstimulation of hormones created by the food. So when you're watching this documentary, realize that. Also, you'll have your periods further apart if you eat a healthy diet as opposed to closer together. They'll be lighter. There are actually there's actually, I won't even get into this, so I shouldn't have brought it up, but there are actually people who thought you shouldn't have menstrual periods. I ran across a few of those in my years of studying. I would just guess these would be people who are so deficient in calorie intake that they probably don't have periods. But anyways, there was a somewhat fanatic group of radical
Probably in
thinkers.
Hawaii, right?
In Hawaii, yes, it was in Hawaii. Menstrual periods are not normal. Oh, excuse me. Anyway, tonight, 10 o'clock, CNN News. Sunday night. It's Sunday night. The date is what, the 19th?
I think so.
Correct. Yes.
2023, Sunday night, CNN News.
It'll probably be repeated.
Maybe not. Okay, Heather, I'm ready for you.
Thank you. Okay, next question. This is from Sandra. She also sent me an email and is wondering if our eating plan has ever helped someone with morphia.
Morphia, I have to remember, you better look it up, Mary.
Scleroderma, I looked it up.
Scleroderma, okay.
Okay.
Thank you. Scleroderma. I was going to say a pigmentation problem. They run into pigmentation problems. It's an autoimmune disease. And but it won't reverse it. I think it will help the joint problems, but the skin problems that you see related to scleroderma, the other connective tissue problems, the tendons that are damaged and destroyed, they're not going to come back. But this is an autoimmune disease, and my belief and the way I practice and the results that I get, which are outstanding, is that it's animal proteins that cause an autoimmune reaction through a mechanism known as molecular mimicry. What happens is foreign protein, like cow protein, pig protein, you eat it, goes through the gut wall into the bloodstream. The body says, this is foreign. This is pig or cow. Even though it looks like some of my tissues, it came from a pig or cow. It could be a virus. It could be bacteria. So it makes antibodies against them. But they're not specific. They also find similar arrangements of amino acids, we call them antigens, in our own tissues. So when it comes to scleroderma, you could just imagine people eating tendons, skin, those kind of things. The body makes antibodies to that attacks your tendons, skin, etc. It gives you a condition called scleroderma. All the connective tissues throughout the body it affects. The interesting thing about autoimmune disease is when you have one, you likely have another, and another, and another. In fact, my feeling is that most people suffer from a low-grade chronic inflammation due to autoimmune problems. Of course, these are people that eat the Western diet. You're achy, you're feverish, you're weak, and you just blame it on this is the way people are. Well, it's not the way people are.
They call it, what do they call it? Fibromyalgia.
Fibromyalgia, yeah. Anyway, I think most people in the Western diet have a chronic autoimmune condition going on. Some people it gets bad. We call it rheumatoid arthritis, lupus, psoriatic arthritis, ulcerative colitis, Crohn's disease, vitiligo. I mean, I could go on. Attacks every single tissue in the body. Eyes, ears. Yeah, because anyway, it's called molecular mimicry. Yes. So yeah, that's the point being is you're not going to reverse the damage you have, but you can stop further damage. You're going to be strict. A little bit of penicillin will kill you if you're allergic to it. You go to the dentist, you say, I'm allergic to penicillin. And it almost killed me last time, doc. Well, I'll just give you a little dose. Well, a little dose, like about that much, has like 100 billion molecules of penicillin in it. There's no such thing as a little dose. You can be strict. And you can be. That's what we teach.
Thank you. Okay, next question. This is from Mabi, wondering if the starch solution helps with moderate hydronephroreader.
Oh, hypernephrosis.
Well,
Hypernephrosis. Okay, my question is is it due to the axillary glands? Is that adenoiditis?
well, to go along with the question, they say that they've done a UTZ and MRI, and now their doctor wants them to do a CT scan, which they want to avoid.
What is it called again?
Nephroreader.
Nephro who? Nephro means like kidney.
Hydro.
Hydro.
Oh, that's
And
kidney.
then
That's
nephro.
swallow with water. Come on now. Nephro, hydro, swallow with water. Come on. What else?
Nephro.
That's kidney.
And then
Hydro's water.
reader.
What is the last one?
Reader. RETER.
I think there's some letters missing.
Okay. Maybe mom can find something. Okay, let's go on to another question. I have so many.
Yes. This is
Oh,
hydronephrosis.
I'll click that.
A condition
Fluid in the
fluid in the
Backup
excess
of urine.
fluid in the kidney due to backup of urine.
You gotta find out what's causing the backup. Is it
Causes could be a kidney stone, an infection,
about
and a
prostate?
large prostate,
Got that one.
a blood clot, or a tumor.
Yeah, there you go. So, first you start looking for the cause. Kidney stones are due to eating the Western diet. I can go through all the discussion with you about how eating a high protein, high oxalate diet causes calcium kidney stones, and 95% of the kidney stones are calcium oxalate kidney stones due to the Western diet. So, that the prostate, I don't know about prostate. I think, well, I have a limited, just a tiny amount of evidence that says that prostatism or prostate trouble or hyperplasia of the prostate, whatever you want to call it, is common in men. They have trouble urinating when they get older. It has an influence on the Western diet. There's a Greek population, Greece, that was studied, where the men didn't have this problem, and they ate a high starch diet. But I really can't make serious claims about it helping that. But kidney stones are easy. Should recurrent kidney stone formers become vegetarian? An article published in the British Journal of Urology in 1979 by Anderson. But anyway, he says, yeah. He says recurrent kidney stone formers should become vegetarians. British Journal of Urology. Robertson.
I can't believe you can remember that.
good thing I have you to help me with all these difficult words. Okay, let's try with some easier words. This is from TS, wondering if aortic and cardiac atherosclerosis is the same. Is one worse than the other? And can they be cured or reversed?
So it's coronary atherosclerosis or what?
Aortic.
Oh, yeah, well, the atherosclerosis, you've got 60,000 miles of blood vessels, arteries, arterioles, capillaries, venules, veins, 60,000 miles. And this blood that flows through it damages all this system. And so you have the most severe damage being present in the coronary arteries and in the aorta. It's caused by eating the Western diet. It starts at 8 months of age on the Western diet. Babies, 8 months of age. And by 2 years of age, 100% of the children studied in New Orleans at the beginnings of atherosclerosis by 2 years of age. You get up into your 20s, studies of Korean soldiers in the Korean conflict showed 70% had atherosclerosis at age 22. In the Vietnamese conflict, one of my teachers, a guy named McNamara, Judd McNamara, did a study in the Vietnamese conflict, and he found that half the soldiers had significant atherosclerosis. Studies on motorcycle accident victims, show that this starts in teens. So yeah, it's due to the Western diet. It does not occur in people who eat starch-based diets. It's epidemic, pandemic in Western societies. Once you change your diet, you stop and or reverse the progression. Who says this? Well, Dean Ornish says this. David Blankenhorn from the UCLA says this. Carl Esseston says this from Cleveland Clinic. See, who else says this? I guess that's enough for now.
Well, you say this.
I say this too. I've seen it in my patients. My patients are just like Ornish's patients. They get well.
Thank you. Oh, did you have something else to say?
Well, I was just going to say, the fact that you have coronary artery and aortic atherosclerosis, you look a little further and you've got it in your femoral arteries, you've got it in your carotid arteries, you've got it every place. It's just big enough to appear on imaging, the area that you're looking at.
So this person wanted to avoid an MRI. You wouldn't recommend that she have one, would you?
What for?
Yeah. Okay.
You need to change your diet. And maybe you judiciously use cholesterol-lowering medication. Maybe you'd be in a category, and it would be a clinical judgment. It'd be you and your doctor sitting down and say, we think you're going to have a fatal or near fatal event in the near future because of your past. And I think I should do everything possible for you. And that may be a baby aspirin that we just talked about, which I wouldn't do anymore. That could be statin drugs and try and get your cholesterol to 150 or less. But it doesn't work well. You don't see a lot of benefit in terms of clinical outcomes, in terms of heart attacks and death. These are very, very, very weak, impotent therapies. The right word, impotent. Yeah, that's good. Rather than word once more.
Okay, thank you. Next question. This is from MV. They're wanting to know, they have multiple intolerances. I'm guessing multiple foods bother them, as well as constant reflux on a plant-based diet. What do you suggest?
So they had constant reflux on and intolerances. It shouldn't happen. Well, I can think of, people would get GI disturbance from, say, eating beans because of all the gas. We've talked about gastrointestinal distress like gastritis being common when you eat raw vegetables, particularly onions, green peppers, cucumbers, and radishes. So I would certainly pay attention to those, and I would eliminate any foods you already recognize as troublesome. And then to sort things out, and it should be sorted out in like 4 to 7 days. You don't have to do this test long. Is eat a really simple diet. Say mashed potatoes are what you get. Mashed potatoes, and you could just live on mashed potatoes for years. But let's just say mashed potatoes and a cooked green and yellow vegetable, all thoroughly cooked now. That would be your meal plan for the next 3 or 4 days. See if it quiets down. See if you stop the distress, the indigestion. I would be extremely surprised if we couldn't figure out something to solve your problem. Simplicity. And the foods that are troublesome are raw vegetables, particularly greens, onions, green peppers, cucumbers, and radishes, raw, cooked, they don't bother you. Fruit juice, like pineapple juice, orange juice, terrible indigestion. Pineapples and oranges don't do it, but the juice does. I would also, if you're having indigestion, I'd raise the head of the bed. Yeah.
Thank you. Good suggestions. Okay, next question. This is from Jill, and she's wanting to know if our program can cure depression.
You could do it at home. Worldwide, there's an association between eating the Western diet and depression. Now, how could that be? Well, there are all kinds of factors involved in depression that aren't practiced. All kinds of habits, good life habits that aren't practiced by people who eat the Western diet in general. One is their diet, Western diet. We talked about how the Western diet blocks the transfer of tryptophan into the nervous system, where it turns into serotonin, which is a neurotransmitter which relieves depression. We've talked about how physical activity produces endorphins, which is the runner's high. We've talked about how sunshine relieves depression. It's called seasonal affective disorder. And the last thing I try and talk to you about is sleep. Too much sleep causes depression. You can prove this over a weekend. Just sleep in. Or better yet, when Monday comes along, just get 5 or 6 hours a night and see how your mood changes. You know this. You've been through this before. You've had weekends where you get a little extra sleep, and Saturday and Sunday were kind of blue. You remember your days in college when you pulled all-nighters. You stayed up for 2 or 3 nights without any sleep. Everybody was manic. It's the most powerful tool there is. Set your alarm clock. How much sleep do you need? Well, most adults need 6 or 7 hours.
You wrote a whole newsletter on this. You could tell them.
It's my March 2004 newsletter. Thank you. March 2004. You'll have
It goes into complete detail
with references.
Yeah.
Thank you. I'll put that in the chat. Okay, next question. This is from Raina. She's female, 32 years old. Doctor advised me to take ursodeoxycholic acid, 300 milligrams 3 times a day to get rid of her 12 millimeter gallstone. She's wondering if it'll hamper sex hormone production, and she's also on levothyroxine for hypothyroidism. Sorry, that was long.
Well, I think what they're describing is Actigall, which is a kind of the bile acid she's mentioning, which you take if you have gallstones, and it dissolves the gallstones, which are made of bile acids. There are different bile acids that form a gallstone, and there are other bile acids that dissolve gallstones. Well, Actigall is a bile acid that dissolves gallstones. It was popular 20 years ago. Not so now. I haven't heard of doctors prescribing it, except for this doctor.
Why? Doesn't that work?
Well, what happens is the gallstones go away.
Yeah.
But people keep eating the Western
When
diet,
they come back.
and they come back.
Okay.
So it fell in disfavor because as soon as they took them off the Actigall, ACTAG, never mind.
ACTAGOL.
That's good enough. Actigall. Once they took them off, then they reformed the gallstones. Every doctor knows. Gallstones are due to supersaturation of the bile with cholesterol. What many doctors don't think about, or dietitians, is the fact that cholesterol is present in only significant amounts in animal foods. So how do you get a supersaturated bile, which everybody knows is the groundwork, is the foundation for gallstones, because they're made of cholesterol. Yes, they are. Where do you think that cholesterol comes from? So anyways, you stop eating the Western diet, you go on a no cholesterol diet, which our diet is. And the gallstones, they usually stay there. They don't dissolve.
But they don't bother you.
They don't bother you. They're asymptomatic. Leave them alone. The research done shows that if you find gallstones in a person and you send them off for immediate cholecystectomy, taking the gallstones out, as opposed to just wait and see, the risk of death and harm to the patient is far greater with immediate treatment than just watchful waiting. If you start having problems sometime in the future because you haven't been wise enough to change your diet, that's the time to get the stones removed. But right now, the stones are doing you a great favor. You don't realize it. They're saving you from a heart attack or a stroke, or, if they occurred early enough in life, breast cancer or colon cancer, because they're going to cause you to think about your food. because you're going to get pain right on here in the right lower quadrant. You'll say, aha, I remember that Dr. McDougall told me that that pain could be relieved by a low-fat diet, and it's due to what I eat. So now you eat good, now your risk of heart attack, strokes, diabetes, obesity, need for web pound.
Oh, I forgot already.
Web, I think it's what WP, POUND, or WB, web, I don't know. It's a new one. It doesn't matter. GLP-1 agonists, like Wegovy and anyway. It's the food. It's really that simple. If you're trying to make it complex, then you're missing an opportunity. It's just a matter of getting rid of the food poisons, which are animal foods, animal secretions, or body parts, which you don't like anyways, and replace them with a starch-based diet. You get rid of the oils. No free oils, no olive oil, no canola oil, no none. Safflower, corn, none of that stuff. This is at best a poison. No, at best it's a drug. At worst, it's a toxin. These oils are. They're not part of nature. They don't occur in nature without some type of manufacturing going on, like pressing.
Thank you. Okay, next question. This is from NYCAC. They're wanting you to talk a bit more about type 1.5 diabetes.
That's an important one. And the reason is, from the patient's point of view, the patient is told they either have type 1 or type 2 diabetes. But no matter what they do, they can't get better, even if they lose weight. Type 1.5 diabetes is it's a spectrum. Type 1.5 is a spectrum. It is a kind of diabetes where you don't produce enough insulin because the pancreas may be damaged, and you have significant insulin resistance. Because of that, you make a little bit of insulin, which keeps you out of the hospital, keeps you out of ketoacidosis. But because you don't make enough insulin to keep you from having a high blood sugar, you develop excessive urination. Because of the high blood sugar and the excessive urination, you are thirsty. Because of the lack of insulin, you don't have enough to keep you out of the hospital, but not enough to keep your body fat on. Remember, insulin pushes fat into fat cells. So a type 1.5 diabetic is between type 1, no insulin production, and type 2, where they make as much, if not twice as much insulin. It's part of the spectrum. And what you need to figure out is where you fall. Can you correct things enough to not need any medication, to have a reasonable blood sugar and to keep your weight on? You only find out by losing the weight. When I know somebody has type 1.5 diabetes, they're a trim person with an elevated blood sugar, and they may have symptoms of excessive urination, thirst, and weight loss. So what do I do with them? Well, remember, they're insulin deficient, relatively so, not absolutely so like a type 1, relatively so. So I give them a little insulin. I give them a little long-acting insulin, which is called Lantus, or Levomor is another brand. And I give them like 5 or 10 units. They take it in the evening before they go to bed. Stops the weight loss, stops the excessive urination, causes some weight gain if they desire, and maybe lower the blood sugar a little bit. But the problem is, that's from the patient's point of view. The doctor's point of view is the same. Most doctors don't understand that there's something in between type 1 or type 2.
You never hear anybody talk about it.
No, it's partial pancreatic insufficiency. It's that you're making enough insulin, stay out of the hospital, but not enough. So you're not, you still have some symptoms of disease. Give a little insulin, cause them to have a pretty nice life. And by the way, there's a new insulin that comes out, new insulin that they're studying is coming out. You give the shot once a week. And the blood sugar controls are as good as if you give it, once a day.
Thank you. Okay, next question. This is from AA Strumming. They want to know what you think of beta blockers. Are they dangerous? This person has PVCs and their doctor's recommending them.
Okay, well, first of all, the beta blockers actually may increase your risk of severe arrhythmias. Okay, so you got to be aware of that. You need to be symptomatic before I'd even consider taking a beta blocker. What the beta blockers do is they block the effect of epinephrine, which is produced in the adrenal glands, on the heart muscle, and they block this effect of adrenaline on the heart muscle. That's why they're called beta blockers, and they weaken the heart. There's some people who take these beta blockers that can't walk up 3 stairs because they're so weak. There's some evidence that, let's just leave it at that. If you're symptomatic enough to take a medication every day, then a beta blocker, I think, is a reasonable choice. But if you're just taking it because you think these arrhythmias are dangerous, then you better rethink again. Likely, and that's not all arrhythmias, but most of the arrhythmias, the common ones you come in contact with, likely you'll increase your risk of dying, not decrease it by taking these drugs. But you may also quiet down an arrhythmia that's troubling you during the day and night. I used to prescribe beta blockers as my second-line therapy after diuretics for high blood pressure. I still prescribe beta blockers. Like if I have somebody who has atrial fibrillation and I need to slow their rate down below 110 beats per minute, I'll give them a beta blocker. Beta blockers are also used commonly by speakers, people who need to give stage presentations. It calms people down so they don't act nervous on stage. So that's another use for beta blockers. Lowers blood pressure too, but it's not a first-line therapy for blood pressure. Diuretics are, particularly chlorothalidone, which I just gave you look in your chat. I just gave you the article, a Cochrane review.
Thank you. Okay, next question. This is from Marlene. She says she's addicted to sugar. She's got some weight to lose. She takes nasty Ozempic for her type 2 diabetes. She can't eat vegetables, but she'd rather just eat starches. Is this okay?
Yeah, absolutely. You can't eat just starches that are grown above the ground. These are legumes and grains because they're missing A and C. So you have to have a little fruit or a little vegetable. How much? A slice of orange daily, a flower to broccoli daily. Otherwise, you can live on rice or corn or wheat or barley. These are above ground storage organs. Below ground storage organs, you don't need to add anything except B12, which we can talk about later. The below ground storage organs, like potatoes, are known as the anti-scurvy vegetable. That means scurvy, which is caused by vitamin C, they're loaded with vitamin C. So yeah, you can do that, but sugar doesn't cause addiction. I'm sorry. Sugar is desirable. It's right there on the tip of the tongue, but so is starch. There are starch tasty taste buds on the tip of the tongue. Why do you think industry puts sugar in so many foods? They know you love sugar. But answer this question for me. How many friends and relatives have you known that have stopped sugar who've had withdrawal symptoms? Have they ever had seizures? Oh, no. Severe headaches? I don't think so. Anyway, it's a strong habit. It's desirable, and that's why you're confronted with so much sugar. Should you stay on the Ozempic? Why don't you just change your diet? Heather, what do you got going on for the next week or so, month, 2 months?
Well, we have a holiday sale that's starting on Wednesday. That is 25% off all of our mini courses. So that'll be great. And I'm also, I know you get mad at me for this, but I'm giving away all the digital books for free.
Oh,
December.
Heather, that's like $120 worth of books.
I know, but it's great to share.
Free, you're giving them 120. My best books.
It's Christmas.
The McDougall Program for Healthy Heart, the McDougall Program for Women, the 2 McDougall Health Supporting cookbooks, the McDougall Plan and McDougall's Medicine. 6 books you're giving away. That's okay.
I know, and I think one of the great things is that you wrote some of them, over 30 years ago, and I'm still proud to share all of that information. It's still relevant and current. So,
because I put years into producing these books, I haven't had to go back and change anything. And any updating I've done, I've either done in videos or I'm doing with you at 5 o'clock. To show you the truth don't change.
But you're not updating it to make it different. You're just showing people that this was right all along.
Same story, same problems, same solutions. It's the old information. Goes back to the first chapter of Daniel in the Bible 2,600 years ago. Look it up.
it's the food.
It's the food.
So yeah, we'll be busy with family and friends over Thanksgiving, but I think we're still planning on getting together with everyone next Sunday at 5 p.m. Pacific. Yes.
Yes.
I'll be available.
Okay.
We'll be here.
Yeah. When's the next program you're going to run? Have you got any room for people?
The next program is January 13th. It's filling up fast.
Why?
People are already having their appointments with Dr. Lim, our medical director and support specialist. So we're already getting started with the new year, and it's exciting.
Oh, I bet they like that. Feel like they're already getting started on the program. So when they get there, they've already got a head start.
Absolutely.
Well, we got a lot of things available for people to take advantage of.
Yep.
Oh, I wanted to tell a story, which really I was trying to figure out a place to put it in, and you didn't talk about anything about it, but I saw this thing. It was a little video in one of my newspapers today.
Yeah.
And it was this Black man who came on TV, and he said, I know there's a lot of people out there that are the color that I am or a lighter brown, and you have a hard time digesting lactose. And lactose is in milk. And so every time you take milk in, you get sick and you wonder why. He says, I want to take you over to the dairy case, and I'm going to show you all the things you can buy without lactose. And so he showed pictures of almond milk and soy milk and, all the other things that are made without dairy. And he said, you don't have to be sick anymore. There's all these things available in every grocery store. And I thought it was kind of amazing to see somebody like that do something like that.
So any dietitian who says you never outgrow your need for milk, and everybody should be consuming milk, they suffer from racial discrimination.
They do.
Because they're condemning non-white colored people to sickness by consuming lactose, which are Inuit Eskimos, Blacks, Hispanics, Asians. 80 to 90% of Blacks, and 60 to 89% of people are lactose intolerant. It makes them sick. How in the world would any professional person come to such a biased conclusion? Oh,
advertising.
You never outgrow your need for milk. But even baby cows outgrow their need for milk.
They do, don't they?
They go on to a vegan diet. See, baby cows go from milk to a vegan diet. It's time for you to grow up.
All right. Well, our hour's up. Thank you, Mom and Dad, Dr. McDougall and Mary. That was fun. Thanks everyone for tuning in.
See you next Sunday, 5 p.m. Pacific time.
Have a great Thanksgiving.
YouTube channel. Bye-bye.
Happy Thanksgiving. Thanks, everyone. See you.